This presentation will cover the theory of planned behavior and how it relates to advanced nursing practice today. The theory of planned behavior is designed to predict and explain human behaviors in specific context. It explains the variance in behavioral intentions and predicts behaviors, including health behaviors. It can be applied to the concept of coping, which I have explored previously. Coping can be defined as the conscious, intentional behaviors for coming to terms with stress. Coping is a behavior that can be studied and predicted using the theory of planned behavior. The theory of planned behavior is made up of the concepts of individual motivational factors, required opportunities, and required resources. It relies on the individual motivational factors as determinants of the likelihood of performing a specific behavior. According to Butts and Rich 2018, behavioral intentions are the most important determinant of behavior. These are made up of attitudes towards the behavior and subjective norms. Perceived behavioral control is defined as the belief about whether one can control his or her performance of a behavior. For example, the individual will be motivated if they believe they can perform the behavior. Required opportunities and required resources must also be present for the individual to perform the behavior. These resources can include both time and money needed to perform the behavior. According to the theory of planned behavior, the behavior will be performed if all three of these concepts are present. The development of the theory of planned behavior was influenced by the failure of previous behavioral theories in predicting specific behaviors. Previous theories stressed the importance of general dispositions and attitudes. General dispositions and attitudes were poor predictors of behavior in specific situations. The theory of planned behavior was developed in the abandonment of the concepts of general disposition and attitude. The theory of planned behavior was also developed as an extension of the reasoned action theory, as this theory had limitations in dealing with behaviors over which people have incomplete conscious control. Perceived behavioral control, the main construct of the theory of planned behavior, has been compared to Rotter's existing concept of perceived locus of control. The difference in these two concepts is that perceived behavioral control changes with the context. For example, the behavior may be likely in one setting and not likely in another setting, whereas perceived locus of control is consistent across all contexts. The construct of perceived behavioral control is based on the systematic research program of Bandura and his colleagues starting in 1977. This research has shown that people's behavior is strongly influenced by their confidence in their ability to perform that behavior. This is the idea behind the concept of perceived behavioral control. Perceived behavioral control and behavioral intention can be used to predict behavioral achievement. The theory of planned behavior can be used as a framework for studying and predicting positive and negative health behaviors. Factors found to influence perceived behavioral control and behavioral intention can be targeted in health promotion efforts. Health promotion is a significant part of nursing, making the use of the theory of planned behavior very useful and practical in nursing practice today. The theory of planned behavior can be used to study at-risk health behaviors. The results of such studies can then be applied to direct the focus of health promotion efforts aimed at preventing the studied behavior. The theory of planned behavior has been used as a framework for a study determining which factors influence the decision to accomplish behaviors such as the intentional use of illicit drugs, smoking, and alcohol consumption among adolescents. The two main predictors of the intention to perform these behaviors were attitude and subjective norms. Health promotion efforts should therefore be targeted at changing the attitudes of adolescents related to drug use and re-establishing healthy subjective norms on these subjects. I plan to take this examination of the theory of planned behavior a step further by studying the theory of human relatedness in the context of explaining and predicting behavior. 17 studies using the theory of planned behavior revealed that perceived behavioral control and behavioral intention permitted significant prediction of behavior. There was an average correlation of 0.5, with the weakest correlations being weight loss and receiving an A. The reason for these weak correlations was that these two behaviors seemed to represent behavior with a low level of volitional control. The highest correlation is represented by voting intention and behavior, as voting poses no problem in terms of volitional control. Here is a summary of a study using the theory of planned behavior as a framework. Predicting HPV vaccine in college men. The purpose of this study was to test the theory of planned behavior constructs in predicting HPV vaccination intentions. The participants included unvaccinated men aged 18 to 26. It was conducted in 2015, and it concluded that the attitude toward behavior and subjective norms, both constructs of the theory of planned behavior, were significant predictors for behavior intention. They accounted for 58% of variance. It was determined appropriate for practitioners to utilize for the evaluation and development of interventions to increase vaccination intentions in this population. The specific recommendations for practitioners include increasing awareness of the HPV virus and HPV vaccine, target first-year undergraduate students, promote positive attitude towards the vaccine, and increase normative attitudes towards the vaccine. The previous sample study discussed is a great example of how the theory of planned behavior might be used in advanced practice nursing. This study could be performed and/or utilized by APRNs working as student health providers at a university to improve the intentions of receiving the HPV vaccine. Studies such as this may also be used by an APRN working in primary care or reproductive health that may be attempting to develop, improve, or evaluate health promotion efforts related to the HPV vaccine. Studies using this framework could be applied to any health behavior or health promotion effort by APRNs. The theory of planned behavior relates to any and all disciplines, as its constructs can be used to explain and predict all human behavior. Its strengths include its ability to be applied to any human behavior, and including behaviors that are under conscious control. Its weaknesses include correlation of only moderate magnitude, lack of reliability in measuring constructs due to the subjectivity of its participants, limited usability with behaviors out of conscious control. I will be able to apply the theory of planned behavior in my everyday practice as an advanced practice nurse. It will be useful in guiding my development of health promotion counseling for my patients. I may use it to conduct formal studies to guide health promotion efforts, or use existing studies to guide health promotion.